So when you were doing residency, so what were the early challenges you faced during your residency in ophthalmology?
So it was more of an opportunity than a challenge. Because when I was doing my senior residency, I was in AIMS RP Center. So when we joined in the retina unit, at that time, the machines were very, very basic. And we used to spend 2 hours repairing the machine and half an hour doing the surgery. That was the time when you have a vitrectomy case, you will do that way. The new machines just came in at that time when we were senior residents, when we had just joined senior residency. So we and our professors were learning the new techniques simultaneously. And we being younger, we had an advantage of picking up the technology much faster. So we have seen it evolve. So therefore, we are very comfortable with the newer machines. Plus, we also had the background of knowing how the machines are working. We had the background of knowing how to deal with the machines which were not working also, because before that, the technology were not that great. So that gave me a lot of inputs into seeing how the things work and how best to adapt to the new system. So it was a blessing in disguise for me that I was learning retina at a time when retina was exploding. So we could know from the base up how the things are working. So therefore, even now, if I'm operating and machines are machines, in case something goes wrong, I know how the things work and how can I take care of that part. So that is one skill that I have, which unfortunately I see the newer people who are working straight away from the best machines, they haven't learned that part. So I think I even tell them that you have to start with the basics. You should know what the machine is doing before you blindly follow the machine. So that has been the benefit for me.
Sir, after all these years in medicine, so what belief system you have developed to treat patients' life and to live your life effectively?
So one thing that I really, in my journey, I did my training at AIMS, did my MBBS, my post-graduation senior residency from AIMS RP Center. I went to UK only for a brief while, for 2 months only. So there I did not learn ophthalmology because the kind of training I had at AIMS was much better than what anyone else can teach anywhere in the world. But in that 2 months period that I was there in the UK, I learned how to deal with the patients, how to make patient comfortable when they come to you, how to crack a small joke with the patient so that he gets comfortable with you, how to educate and involve the patient in their healthcare, which unfortunately at AIMS, no one was teaching you that. And because we were in a government setup, there's a pressure of work. So often these are small things that we tend to overlook. So I learned the art of practicing medicine in the UK, and I learned the science of practicing medicine in India. So that is one thing that I got from there. And ever since I started my practice in 2001, this is one thing very important for me, that to involve the patient in their own healthcare, not to treat them just like that, okay, you do this. It has to be more of a two-way process. You educate them, involve them into their eye care. Because what I feel is that if I'm, say, treating you, I tell you, okay, Satyam, tere ko ye karna hai, without explaining why, you will follow those instructions for some time and after that you'll tend to ignore it, right? Because you don't know why it is important. But if I explain to you that what I am doing and why I am doing it, then you know the logic behind it. Then the chances of you following that instruction is much more. So I like to educate my patients into their healthcare. I like to give them minimum of restrictions. So I very strongly believe if you tell them 10 things not to do, they will follow 8, they will leave out 2. And chances are those 2 they leave out are the more critical ones, right? So I will tell you only 2 which are most critical to follow. I don't want to give unnecessary restrictions to my patients. So often the patients, my common question when the patient comes for follow-up is, क्या परहेज कर रहे हो आप? And then they'll tell you these parage, then I tell them, ये तो कुछ भी नहीं करना. So I have a very minimal list of restrictions after the surgery or anything. And whatever I tell them with the reason. So give them less restrictions, but explain them why. For example, in COVID, like what we saw in COVID is that people were given so many restrictions. They were following everything. They were washing their hands. They were spraying disinfectant all over the place. But what they were not doing was they were not covering their mouth and nose properly. That was the only thing that they had to do. But they were following the other unnecessary instructions and they were forgetting the more important ones. So if you give them too many restrictions, they don't follow the more important ones because that's the more difficult one, right? So give them less and explain to them. So I like to educate my patients, get them involved in the healthcare. So that has been my philosophy from day one when I've been practicing. And that's where somewhere my name Synergy also comes in from, because I like to make the patients as their partners in their healthcare. So it is not a one-way street. It has to be a partnership, mutually
Partnership.
beneficial partnership with
Hmm.
them.